come in. Take a seat. Take a seat. Take a seat. Okay, welcome to this cozy hospital. I'm a nurse Murmurs, and I will be looking after you today in this examination room. Okay, so this is our treatment room for minor injuries. Okay, I am going to begin by asking you some questions so we can get your name, get your patient file up, and then we'll go through your injuries, okay? So can you confirm your full name for me? Okay, and your date of birth? Alright, and what's the first line of your address? Okay, do you have a post or zip code? Okay. And what's the best contact number to get you on? Great. Okay. Yeah, we'll look this up after. I'm using paper just now. Our electronic records are not working properly at the minute, so just make sure I have all this information for you. Okay, so do you want to tell me a little bit about why you're here today in the treatment room? Oh dear, yep. Oh, that does sound sore indeed. When it starts to get a little bit colder, sometimes we get taken back by icy conditions, indeed. Okay, so you slipped exiting your vehicle. Okay. I do see. So we have a lesion. Okay, on your head, forehead. Does need cleaned up. Okay. Left arm. You want me to look at your right wrist? You've grazed your knee as well. We can have a look at that. What's that on the left side? Okay, so is there anything else that's sore? It's just those things. So your forehead, your left arm, right wrist, and left knee. Okay. Have you had a lot of blood loss or just what you told me about? Okay. Now can I ask, do you have any medical conditions that I need to be aware of? Medical history? Okay. And anything else? And are you taking any medications at this time? Okay. Okay, none of that should interact with anything that I'll give you today. I may give you some painkillers or anti-inflammatories. Yeah, just depending on how this goes, okay? Alright. So, to begin, I need to take some vital signs from you. So, we'll be listening to your heart rate, your lungs, and also doing your blood pressure as well. We need to make sure that everything looks good here, okay? Before we assess the injuries, I'll then fully assess all the injuries, and then I will get to work in treating every one of them. Okay. Okay, I'm also just with that lesion on your head. I'm gonna do an eye check as well, just for concussion. Yeah, okay. Alright. Just try and remain as calm as possible for me, thank you. And I'm just gonna lift this your shirt up gently. There we are. This may feel a little bit cold on your chest. So just breathe in and out as I listen to your heartbeat, okay? Okay, that was absolutely fine. I'm just gonna listen right to your lungs, okay? Just breathe in and out. So breathe in and out. Breathe in and out. And breathe in and out. Good. Okay, we're gonna do your blood pressure. I prefer to use my manual kit. I find them a lot more accurate actually than the digital, believe it or not. Alright, which is your non-dominant arm? Just slide your arm in there for me. Great. Okay, I'm just going to get some air into this. There we are. We're just going to do this 3 times, okay? One. And one final time. Yeah, that was fine. You were 132/76. Slightly high in the systolic blood pressure, but not too bad. Okay. Just slip that off for me. Okay. I'll pack that away. Alright. Okay, let's now assess these injuries. I see, it's quite deep. Okay. I think we're gonna need stitches in this one. Probably get away with butterfly stitches. And then a medical grade plaster over the top of it. But it will need something to help it heal. Because you've really quite given yourself the cut there. But it's clean, which is good. It's a clean cut, a clean line. So it should heal nicely and you'll not be left with too much of a scar. Okay. This side. Let's see. Oh yeah, I can see the contusions here. The purpling of your skin. Let me just feel that. I don't think it's broken. You can move your arm back. Yeah. Okay. Yep. Yeah, I think we'll probably clean that up. I don't think it will need any stitches. I think we'll just cover that up and treat that one. Okay, and your wrist here. So you weren't sure if your wrist is broken. Okay, let's have a look. Okay, can you rotate it like this for me? Okay. Yeah. All right. Let me see. Okay, I'm just kind of feeling that here to see what we think. Yeah, I think this, I don't think this is broken, but I do think you have sprained it. So I think what we will do is, yeah, I'm going to probably bandage that up for you with a nice bandage. You do have a little bit of a cut that will clean. And we'll put a nice bandage on that. And we can give you a sling away as well. Alright, and you want to show me your knee? Ooh. Yeah, I see. Let me just. That needs a good clean out. Yeah, it's more superficial, but we'll clean that out for you. Give that a really good clean. And then, yeah, we'll put plaster over that as well. Alright, so you happy with that? Okay, let me just get some bits for you. So I'll use some of these. And the strips as well here. Dressing as well. Just gonna start with this here. Which is your wound cleaning strip. So we wanna make sure this is both antiseptic and an antibacterial and an antiseptic. So we're just cleaning this lesion like so. Okay. And then we're going to grab the adhesive strip. Okay, we're gonna put this on here. Like so. There we go. That's that one done. Perfect. Does that feel okay? Good. Good. Let me just see. We're gonna move on to your arm now, the grazier. So I'm just gonna gently massage this. So we're just getting rid of any debris. Okay. All right. Okay. Okay. We are gonna just add a plaster onto that one. We're just gonna pop that on there, like so. Alright. Okay, and then we're gonna come across to this one here. So let me see your wrist. It's a wee small graze. That will not need to be a plaster. You'll be alright. Okay, and I'm just gonna wrap this around. So we're going to bandage your wrist, okay? That's it. So just, I'm going to do it quite tight. So this is going to help with your sprain. Alright. And it's up to you, we can put you in a sling as well. There, nice tight. So I'm going to tie that in a little knot for you. So try and keep it dry when you're showering, okay? And that should help support your wrist until your sprain heals. And I'll give you some medication away with you as well. Okay, and then moving on to your grazed knee. Okay, let's have a look. Yeah, we just need a good clean of that, so we'll use we're just going to get this a really good clean with this antiseptic wipe, okay? See, look, that's getting a little better now as well. Okay. And we will add a plaster to that too. Just to protect it while it heals. See you. And there you are. Alright. Perfect. And now we're just going to check your eyes. As well as I mentioned. Yeah, we just want to make sure you don't have any concussion. You've not had sore head, dizziness, anything like that. Just like from the, yeah, you're not being sick. Alright, you can look up for me. And look down. Okay, and look to the side. And to the other side. Great, thank you. Up again. And down. And the other side. Okay, I'm just gonna quickly check your pupils' reactions. Okay, I think that's all fine. Okay, I want you to look at this and follow it as it comes in. And out. And in. And out. And in. And out. Alright. Okay. And then I'm going to cover each of your eyes, and I'm going to, so if I cover this eye, I want you to look at my shoulder, and then I want you to tell me when you can see my fingers. Okay, I'm going to cover this eye. That's it, focus on my shoulder. Okay, and the other eye, focus on my shoulder. Good. Excuse me. Okay, so we have done your heart rate, blood pressure, checked your injuries, cleaned and bandaged your injuries, and checked for concussion. So I don't think you have concussion either today. Okay, so what I'm going to do for you is I'm going to need to prescribe you some pain meds. So I'm going to prescribe you some ibuprofen for the swelling, and also some paracetamol as well. Okay, so ibuprofen, paracetamol, and you can pick them up from the pharmacy. Now, with your injuries, so please keep your head lesions covered, and the butterfly stitches on for 7 days, okay? Then you'll be able to remove them yourself. And then your bandage, see how you get on with your wrist. I'd say you want to keep refrain from doing anything on it for 2 weeks to let it heal, okay? And then your other injuries, your you're going to cut on your left arm and your left knee. The graze, the plasters can come off within 24 hours. And you want some exposure to the air to help them heal. Okay. Alright, do you have any other questions for me? No? You're happy with that? Excellent. Well, I'm glad I could be of help today. My pleasure.